effective infection control measures. We also consider hand washing as the universal precaution. It is an important measure in preventing the spread of microorganisms. Good aseptic technique involves limiting the transfer of organism from one person to another. By hand washing after contact with a patient, the nurse can limit the spread of microorganisms to other people, particularly patients. In hand washing, both mechanical and chemical means are used to remove and destroy organisms, while soap emulsify foreign matter and lower surface tension, thus facilitating the removal of oil, greases, and dirt. One type of hand washing is the medical hand washing. Medical hand washing is cleansing the hand using medical asepsis by thorough washing hands by soap and water, which eliminates microorganisms, thus preventing patient from acquiring pathogens. Purpose of hand washing: to remove microorganisms that might be transmitted to client, visitor, and other healthcare personnel. To remove dirt, organic materials, and transient microorganisms. Medical hand washing procedure. Preparation: determine presence in client of factors increasing susceptibility to infection. Whether clients use immunosuppressives, recent diagnostic procedures, or treatments that penetrated the client's skin or a body cavity. Client's nutritional status, signs and symptoms indicating the presence of infection. Assemble equipment: soap dish, receptacle, nail cutter, warm running water, disposable or sanitized towels, tray, assess the hands. Nails should be kept short. Short nails are less likely to harbor microorganisms or scratch a client. Long nails are hard to clean. Remove all jewelry. Microorganisms can lodge in the settings of the jewelry. Removal facilitates proper cleaning of the hands and arms. Check hands for breaks in the skin such as hangnails or cuts. Report cuts to the clinical instructor or nurse in charge before beginning work, or check agency policy about cuts. A nurse who has open sores may have to change work assignments or wear gloves to avoid contact with the client's body substances. Procedure: explain to the client what you are going to do and why it is necessary. Check for the type of faucets such as knee levers, foot pedals, elbow controls, and infrared control with the sensor. Do not lean on the sink or splash water on your uniform. Flex your knees slightly if the sink is low. Turn on the water and adjust the flow. Be sure to adjust flow so that water is warm. Warm water removes less of protective oil of the skin than hot water. Wet the hands thoroughly by holding them under the running water. Hold the hands lower than the elbows so that the water flows from the arms to the fingertips. The water should flow from the least contaminated to the most contaminated area. The hands are more contaminated than the lower arms. Apply soap to the hands. If the soap is liquid, apply 4 to 5 ml or 1 teaspoon. If it is a bar soap, rub them firmly between the hands. Rinse the bar before returning it to the dish. Rinsing the bar removes microorganisms. Use a firm rubbing and circular movements to wash the palm. The back of the hands, interlace the fingers, interlock, thumb, and move the hands back and forth. The circular motion helps remove microorganisms. Interlacing the fingers and thumbs cleans the interdigital spaces. Rub the fingertips against the palm of the opposite hand and wrist. Continue this motion for 20 to 30 seconds for each hand. Thoroughly wash and rinse the hands. Get a clean towel. Move one step backward. Moving one step backward prevents the towel from touching the sink. From the cleanest area, completely dry the hand and lower arm with a clean towel. Moist skin becomes chapped readily, which produce lesions. Discard the towel in the appropriate container. Use a new paper towel to grasp a hand-operated control. These prevent picking up microorganisms from the faucet handles. Turn off the water.